Okay, so we're going to get right into this. We are looking at how to care or recognize shock. And one of the things I want you to kind of think about is this is not about putting your finger in a light socket kind of shock. We are talking about trauma shock. So, what happens in a life threatening situation? Car accident, heavy bleed, really bad break, trauma to the body. Um, your body goes into what we call shock, and you're going to see some of these signs and symptoms. You'll see restlessness. You'll see skin color changing to gray. Essentially, what's happening is your body's sending as much energy as possible to the part of the body that needs healing. And so, a lot of times, it takes away from the other parts of the body that might need regular support. In this case, there's nothing. So, for example, blood flow might go directly to an area of injury and it might stop flowing to other parts of the body. So treatment for this pretty simple. Lay the person down. If they're bleeding, change that. So you'll see bleeding care in a future lesson. Cover the person with a blanket or just regulate their body temperature. Make sure they don't eat or drink anything. We don't know if they have internal trauma. And then make sure you have 911 on the way right away in this process. So anytime you have trauma, you see any sort of disorientation from somebody, you can assume that their body is going into shock. So EMS care is super important, and then just monitor the situation. Obviously, if they stop breathing, then you jump into your CPR technique from lesson two. Um, but otherwise, you just kind of monitor them and reassure them that EMS is along and on the way. So that's shock.